the regional government led by His Excellency Dr. Yilikal, we officially launched the rehabilitation program there. We selected that area because 234 houses were totally destroyed.
What empirical evidence do you have to support this claim?
You cannot empirically list down those psychological and humanitarian aspects.
What have you accomplished in this regard so far?
They have been working on research to publish this book.
5 years is a very, very long time for people out there may not have enough to eat this week.
Immediate issues, livelihood issues, life-saving issues, emergency responses is so named rehabilitation. That's what I mean it. The first 1 year.
What it takes to revive particularly the health sector?
11.4 million were displaced. Look, 11 point, I'm not talking about few figures.
What has been the response of key actors in the rehabilitation and reconstruction tasks so far?
It is sluggish, I can say that. It remains on the paper.
Not on the things that you can't, but on the things that you can do.
We'll push them, we'll knock at the doors of those NGOs time and again until they become human.
Do you believe the federal government give enough attention and resources?
I don't believe that. There are gaps.
Do you think it is underreported, undercovered by powerful news organizations?
It's not the information that matters. It's not the data that matters. The interest matters.
As war raged in northern Ethiopia for 2 years, Amhara region has been one of the hardest hit regions in the country. From the very beginning of the war, the region has been ground zero for most of the fighting. Apart from the massive civilian displacement, mass killing, rape, forced disappearances, almost the entire critical infrastructure has been burned, damaged or looted. And it has been almost 5 months since permanent cessation of hostilities agreement was signed in Pretoria, South Africa. Today, I ask what practical steps are being taken to rehabilitate, reconstruct the war-ravaged parts of Amhara region. To entertain this question, my guest today is Dr. Abate Getahun. He is the former president of Wallo University. Currently, he is the head of Amhara region, war-affected areas rehabilitation and Reconstruction Fund Office. You're watching Messenger from Amhara Media Corporation. My name is Yohannes Lijalam. Dr. Abate Getahun, thank you for coming.
Thank you for inviting me.
To engage in any kind of rehabilitation, reconstruction work, first we need to have the factors. And what have you accomplished in this regard so far?
As you know very well, the region has faced multifaceted, intricate problems for a duration of years. So what we have been doing is that problem should be unpacked primarily. Fortunately, when we joined our office, Amhara region war affected areas rehabilitation and reconstruction fund office, which is so named in short R4, started at the dawn of July. We officially began our work a few months ago. To begin our job, it's already the regional government established a legally institute this office, just by regulation number 198 in 2022. After establishing this office, there was a research. Research was conducted, organized by Amhara Region University Forum and Regional Statistics Bureau. So we start from the existing issues. They have been working on research to publish this book. So we began working on this material, finalizing in conjunction with universities and other stakeholders. So we started work by then, and then we have collected the assessments, the gaps, already damages, because there were different types of damages, but this damage heavily focused on starting from June 2021 up to December 2022. So our start began with this assessment.
In a census study conducted by universities in Amhara region, women and children were adversely affected by the war. What empirical evidence do you have to support this claim?
Well, the problem can be classified into three parts. The first one, as I showed, the humanitarian crisis. And the second one is the psychosocial cultural damages. And the third one, physical damages. So we have grouped into three main categories. And our strategic plan, which is framed on this assessment, unpacked the three categories. The humanitarian crisis cannot be empirically, listed, but huge, because sometimes the damages are subtle, and sometimes the damages are, cannot be easily unpacked. So there are huge impacts, because there are massive fatalities, there are displacements, there are rapes, and abusings, dehumanizing discourses, which remain in the minds of the society. So you cannot empirically list down those psychological and humanitarian aspects. But so far, we have identified lists of rapes, particularly those rapes occurred underage, and rapes, old women and other women which are, married women, and even male were raped. So we cannot justify easily, but more than 5,000 women were affected by gender-based violence altogether.
So you have the data and the evidence to support this claim.
Yeah, the discourses are here, and then the book, this book, a large section of this book, focus on humanitarian and psychosocial crisis and the physical damages. The physical damage is accounted 292 billion birr, the first assessment. Now we have made other assessments, the second round damages, the third round damages, and areas are still occupied by the people. Still they are in critical humanitarian and psychosocial impact. Even by now, when we are talking now, dozens of people are flooding and influxing from different parts, and they have been living in a campus. IDPs are huge. So we have that number.
So the book that I'm watching right now, just in front of you, that is the document that you have studied in the past months about the atrocities committed in the region.
Yeah. This is a book written in America, and by now it is translated in English. And this is the first book, and we are producing other books which will be published in the upcoming few months, because we categorize into 4 groups. This is the first, and we expect to have 3 different books that will come in different phases. Phases like internal conflict. This book is related to internal conflict. As you know, the Horn of Africa has many problems, and the brunt of the disasters is here in Amhara region, particularly in the northern part. So we have grouped into different groups: internal conflict, third round invasions, and first and second round invasions, and IDPs, which are still influxing to the region.
So this is a huge book I'm looking in front of me. How many pages is it?
It is more than 300 pages. Now it is translated into English, more than 300 pages.
Let's come to the second question. According to a census study, rape, abduction, extortion, sexual abuse have been widely committed against women and children. In terms of the financial capacity and the know-how, what it takes to help the victims?
As to the regional government, in conjunction with the Federal Minister of Finance, the study reveals that more than 20 billion USD is required when we talk about the whole damages that happened in the past 2 years in the 5 regions, Amhara, Tigray, Afar, Oromia, and Benshangul. When you come to Amhara region, in this book we can find 292 billion damages, but there are other damages which have been unpacked so far, and they are close to 512 billion birr.
When it comes to the know-how, women have been raped, livelihoods have been destroyed. So when it comes to psychosocial support, do we have the capacity to extend that help?
What we are doing is that after unpacking the problems assessment made, we were producing 5-year strategic plan, because the problem is huge. Therefore, we have to address it strategically. It's not a one-shot movement. So we produced a strategic plan in consultation with the regional bureaus, offices, mainly 18 offices like education, health, agriculture, tourism. So we list all around 18 institutions. With the consultation with these 18 bureaus, we produced 5-year strategic plan. This strategic pillar focused on around 5-6 pillars, because you need to have pillars when we produce strategic plan. The first one is physical reconstruction. Second one is psychosocial rehabilitation. The third one is humanitarian responses. The fourth one, redevelopment and job creation. The fifth one, resource mobilization. The sixth one, coordination, partnership, and communication. These are the pillars of the strategic plan. So we produce this strategic plan with these 18 bureaus because we plan to have one plan, one budget, one report. Because we have scarce resources. We don't have ample resources. Therefore, to alleviate the problem, we have to collect the scarce resources in one fund office, so that we'll prioritize the issues. We'll prioritize the problems in ascending order based on their levels. So we have been giving now livelihood issues, life-saving activities. Life-saving issues are given prominent places, because the focus of this office is 3 main leading terms are here. The first one is rehabilitation. When you talk about rehabilitation, it should be focusing on immediate needs, humanitarian needs, basic needs. If you fail to get your basic needs, you cannot think of other ladders when you see the Maslow hierarchy of needs. A human being first attain basic human needs. If one individual fails to get basic human needs, he or she cannot don't expect to go to the other ladders. Therefore, we are working on that part, leading rehabilitation. Then, in the second year and third year, we plan to focus on reconstruction issues, because there are basic facilities, infrastructures, like schools, health, agriculture institutions should be built. And the last one, the third one, is redevelopment. When you talk about redevelopment, we're talking about durable peace. Sustainable peace is essential. If we fail to get sustainable peace, we cannot get development. Development is unthinkable without durable peace. Therefore, we focus on 3 terms: rehabilitation, reconstruction, redevelopment. They will be working in a sequential manner. So the regional government, based on the assessment, gave us 1 billion birr. This 1 billion birr, in consultation with the bureaus, we classified and allotted in 9 areas.
So we will come to that, Dr. Abate. Yeah. But first, you are telling me that you have this 5-year strategy.
Yeah.
5 years is a very, very long time for people out there who may not have enough to eat this week and up to next month. There are pregnant women who are unable to give birth or unable to get medical consultation. So what are you planning to address when it comes to people who are in need now and then?
Yeah, that's what I mean. When I say 5 years, you're not always talking about something which is timely issues. We classified into 3 groups.
Okay.
Issues which need immediate issues, livelihood issues, life-saving issues, emergency responses is so named rehabilitation. That's what I mean it. The first 1 year, we heavily focused on that part. And all regional government offices, bureaus are working day and night to avert that problem, to address that problem. We are pushing all GOs and NGOs to support us in line with that issue. That's what you call it rehabilitation. We never go to the other issues. So the development aspects will be coming later. So we are working on life-saving, humanitarian issues, focusing on children, focusing on women, focusing on disabled people, focusing on displaced people.
So how much funds are you garnering or getting for this support, for the immediate need of the communities who are just in need now?
Yeah, the problem is massive. The economy is limited. I mentioned it. At regional level and in Ethiopia level, we need to have 20 billion USD, which is 1.1 trillion. The region has faced, even the first study has faced 292 billion, which is huge. The problem is massive. The regional government assigned 1 billion, which is at hand. There is no sufficient budget, which is because the problem is emerging. There are time-borne problems emerging from different. So we have garnered that. Now the World Bank assigned to the whole Ethiopia 300 million USD, which will be serving for the upcoming 5 years. From that again, we have obtained some amount of money, particularly focusing on 7 districts.
Okay, there are NGOs, both national and global NGOs operating in this country. And do you reach out to those NGOs and garnering support to address the immediate needs of communities in war-affected areas?
Yeah, what we are doing, as I mentioned, first you have to identify the problem. Then you should design its strategic plan. They should be sure to address the problem in a planned manner. So we present that strategic plan for different NGOs and NGOs. And we have made different workshops with them. And we have even knocked at the doors of different NGOs like World Bank, USAID, WFP, and list of others, even with embassies. They knock at the doors of us, and we are knocking at the doors. And we make a discussion somewhere in Kombolcha, and we're having with more than 40 NGOs, and we classified them based on their needs. So we are working on that. That's why some of them are still supporting. Our office is organized by UNDP, and the UNICEF are working on it, and World Bank is working with us. So there are some which are still working with our office.
So you are grateful to those NGOs who are extending support.
Exactly, yeah.
What it takes to revive the health sector in the region so as to help pregnant women access to counseling, give birth under the care of nurses, doctors. We know that the health sector has been massively impacted because of the global pandemic, but on top of that here we have a war, very devastating war. And what it takes to revive particularly the health sector.
Yeah, that is the other sector that I mentioned it, without saying this or so and so. Health sector is one of the sector that we have been working with it. The strategic plan focuses on that part, starting from life-saving to that of permanent development. So physically, the health sector affected hugely. Nearly 13.2 billion damages occurred in the health sector. And more than 31 hospitals were damaged. And many health centers, health posts were damaged, and 118 ambulances were looted, and the remaining ambulance, like more than 275 ambulances, were broken down. So the facilities in the hospitals, 31 hospitals were totally looted and devastated. So what we have been doing is that, as I mentioned previously, we have been now constructing 11 clinics, side-by-side schools. And we are also trying to fill the gaps in consultation with the Regional Health Bureau. And the Federal Minister of Health is working with us. They are supporting us, and things are on the pipeline coming to the regional government. The federal government has signed 56% of the aid to give to the Amhara region. Directly, they are planning to help us. And they are also planning to give us around 18 ambulances from the 35, which is purchased by a Minister of Finance. So we have been doing different issues to address the problems by even linking the hospitals with hospitals which are out of Amhara region, like most importantly from Addis. They are working with Amhara region Health Bureau.
What have you witnessed about the impact of the war on children and what it takes to help them survive, go back to school, and have hope again?
You know, war is a devastating impact. See, it cannot be addressed easily. During the war that I mentioned, it especially started from June 2021 to December 2022, almost a large section of Amhara region is invaded. 11.4 million were displaced. Look, 11 point, I'm not talking about few figures, 11.4 people were displaced. Huge number of the displaced were kids, women, and they have taken the brunt of the war. So they are, you know, in a critical trauma. So we need to have trauma healings. So I've been working with scholars in Ethiopia, out of Ethiopia, who are professional in this area, in mental health and psychology and other trauma healing experiences. So it's huge. A few days ago, I was in Sakota. You know, I visited different IDP centers. People from Tsagibji and Navargale, more than 66,000 kids, together with their families, are there. And I visited some schools. Some schools, I'm talking about schools which are under the tent. It's not a proper school. They sat on dust. They don't have desk. Pure dust I'm talking about. The blackboard is, you know, in front of them. They are still in huge sadistic situation, traumatic situation. So how do we treat them? We need to treat them for many years.
Homes were also destroyed in the entire residential areas were in some places literally turned into grave sites. And how big is the challenge to provide families with shelter? Now it is the summer season, but the rainy season is not far too long. How big is the challenge?
Exactly. Huge numbers of houses were demolished, distracted, looted. Now, even in this book, you could find 52,000 houses were in a scattered manner demolished. And they have been living with that life. We tried to address by purchasing some corrugated irons and needles, and we have been distributing that to some areas which are totally demolished, like the village. When you start officially rehabilitation program in North Wollo, what is called Warke, there are 2 kabbalists in that area. The regional government, led by His Excellency Dr. Yilikal, we officially launched the rehabilitation program there. We selected that area because 234 houses were totally destroyed. 234.
34 houses.
Houses savagely destroyed, burned out, together with all equipment there. They were, you know, naked. So we gave them, we're planning, you see, to give them corrugated irons and nails and the remaining materials will be supported by the community. So the problem is huge, but we have been trying to address the problem. But we are still calling individuals, NGOs and NGOs to supplement, to support these groups, and the problem is massive.
So you are assuring me that the region cannot mobilize all the funds needed to rehabilitate and reconstruct war-ravaged communities, places in this region.
Exactly. Not only the region, even Ethiopia. As I mentioned previously, the overall damage in Ethiopia is 28.7 billion USD, which is almost 1.5 trillion. And we need to get 20 billion USD, which is 1.1 trillion. Even at Ethiopia level, and the regional, it's not even alone the regional part, even in Ethiopia, the devastation effect is huge. So we may get few amount of money because the world is in critical problem because of the war between Ukraine and Russia, and they have their own interests. So we cannot easily alleviate the problem, but we should challenge it. We have to support each other, and every individual here in Ethiopia, out of Ethiopia, should support to address the problem.
What is your assessment of the federal government response when it comes to rehabilitation and reconstruction activities in the region, even from the physical budget? What is your response to that?
I can't find frolic support so far. As you know, the problem is huge even in the Ethiopian level. The economic issue is critical. There are conflicts here and there, and we have not collected sufficient amount of money even internally, and there are time-borne problems which creates huge problems. So, Amhara region is a large region with huge population. So the thing which happened here has a huge impact on the other. So we haven't, collected that frolic supporters from be it the federal government, even from the NGOs.
Do you believe the federal government give enough attention and resources from the available resources to this region, considering the kind of devastation that the region has incurred in the past 2 years?
I don't believe that. There are gaps.
Okay.
They seem to be, digressing and pushing to the other areas, and the Amhara region hasn't, in line with, leave alone that even NGOs and NGOs haven't given enough emphasis to the region, though there are some attempts. Even the monies which are given by the World Bank is still sluggish. Its movement is not promoted.
It is almost 5 months since the signing of the permanent cessation of hostilities agreement in Pretoria, South Africa. And what has been the response of key actors in the rehabilitation and reconstruction tasks so far? Because they have been promising that once there is a permanent cessation of hostilities, they are going to provide more support for rehabilitation, reconstruction, or somewhat even in development sector.
Yeah, that I mentioned, it is sluggish. I can say that it remains on the paper. It is not descended down to the ground. The disarmament processes, the reconciliation, different aspects remain on the paper. They are not on the ground now.
When it comes to the destruction, the looting, and all kinds of damage on human life in this region, comparing to other regions who have been affected by the conflict, do you think the region has got enough attention?
Leave alone the other one, the developmental aspect. Even the humanitarian aspects seem to be ignored. It doesn't give, huge emphasis. We found only few humanitarian organizations that are working in some parts of Amhara region. You cannot find them. So they give it downgraded. So it's not so far folkloric.
You are tasked with a very difficult job of finding resources, funds for the destruction that really needs billions to rehabilitate and rebuild. What can you say to those donors and key partners out there who are watching this program?
People shouldn't be ignored based on this ethnic group or that group. It should be treated as a human.
So do you believe that the people who are in need are Amharas? Do you think they are left out by NGOs, international organizations?
Even though they are not left out, I'm saying that the problem is not properly addressed in line with the amount of damage occurred in the region. The region has faced huge numbers of people. As I told you, more than 12 million people are affected by this. And there are huge numbers of displacements from different areas. There is displacement from Sudan, and there is displacement from Tigray, and there is displacement from Oromia. Even there are displacements from Addis Ababa. So huge numbers of people are pushed towards Samarra. Basically, some of the people are pushed because even they don't know why they are pushed toward this. So in line with that, in equivalent with that, we have never attained supporters from the global community. They know the problem. They know the source of the problem, but sometimes they kept quiet.
Do you think it is underreported, undercovered by powerful news organizations like the New York Times or Washington Post or whatever that powerful decision makers rely on for their information?
It's not the information that matters. It's not the data that matters. The interest matters. There are medias which are deliberately disinformed the global society. Disinformation is huge. It's not only misinformation. Huge media disinformed the global community. And there are medias which are producing false narrations. Slanted discourses are emerging here and there. Because of this or that, because of their interest, even though they have the data at hand, they will never release it to the media.
Not on the things that you can't, but on the things that you can do. What should you do to tell the people, characters, NGOs and countries who are really willing to help people because they are suffering? How are you trying to reach out to these people? They may not have the factors. We can't be sure on that.
Yeah, what we do is that we have been working on that. This book is produced in America. Now we are translating in English. We are expected to produce enough information to anybody across the globe. And we need Amhara, Amico to support in this area. We need the media to support us. One thing is the other one. So please let's work together to address the information, whether they use it or not. Let's work together. So our office will work with that direction day in, day out. The other thing, we'll knock at the doors of the NGOs to be human, to act human. They are talking about humanity, but sometimes they fail to do so. So we advise them to act out in that aspect. They have their own principle: humanity, neutrality, and unity, something like that. They will tell you a lot of motivational terms. They remain on the paper. So we'll push them, we'll knock at the doors of those NGOs time and again until they become human.
Dr. Abate Getahun, thank you for coming.
Thank you very much again for having me.
This brings us to the end of today's program. Until we meet next time with another guest, another topic. The presenter of the program, I'm Johannes Lijalem. Thank you for watching.